Welcome, everyone, to the Revenue Cycle Truth Podcast. My name is Josh Beerling, and our goal on this podcast is to share engaging revenue cycle insights and content from some of the leading experts in the industry. So today we're going to be talking with Stephanie Dorwart. Stephanie is the CEO of Altius Healthcare Consulting Group. She has over 20 years experience in healthcare and HR, and she did work with a 300-bed hospital in the Pennsylvania area. Stephanie, thanks for joining us.
Yeah, thank you so much, Josh. I'm happy to be here and share information with your listeners.
Perfect. Awesome. Yeah, appreciate you coming on. So, just given where I want to start from a high level and just kind of curious about what you can offer, and just kind of given the current environment right now and everything that's going on, I would imagine staffing and workforce and everything is kind of in flux. And I know I've talked to a lot of people. I probably had more conference calls this week than I've ever had in my entire career. And it just seems like a lot of people are moving around, wearing multiple hats. I guess just starting there, what are some of your thoughts, and what are some of the solutions that can kind of be, found at a time like this?
Great question. And absolutely right now, we're going through something that healthcare has never experienced in our recent history. And depending on what part of the country you're operating in or what type of healthcare organization you're in, really depends on what type of solutions you're looking for right now. We're experiencing everything within our country from the New York City climate, where they're currently trying to understand how they're going to add 50% more capacity to their hospitals when they do not have 50% more staff. So the challenges in a market that's currently at the height of their COVID-19 coronavirus outbreak is they're working through how are we going to actually have enough staff to staff the new facilities and the new beds? Where are we going to pull those resources in? So what we have heard from clients in those situations is they're doing a few different things. Number one, they're looking across their facilities to identify resources that they could quickly train and or redeploy to support ICU beds, respiratory therapy activities, testing sites, any of those other locations, and repositioning personnel that might be in physician practices that have had to cancel elective surgery. They are also pulling in traveling nurses from other parts of the country, and if you would believe it, nurses from other hospital organizations that are not being as hit or as impacted yet by the COVID-19 situation to their locations so that they have enough staff. So if they're in the height of it, number one, you can identify resources within your facility that you can redeploy. Number two, if you're on the other side of the situation where maybe you have not even had a case in your county yet, what we're seeing in those markets, in those locations, is that those hospitals are now looking at actually understanding how far they're going to have to downsize with the reduction in elective cases that are occurring. And what we're talking to our clients with there is you have productivity reports right now. Most people are telling us they're not paying attention to their productivity reports. What we're saying is, no, you can use your productivity reports, you can still use your staffing reports, but you need to use them for different purposes. And the purposes right now are to, number one, identify where you do have opportunities within the resources that you have now to either allow people to work remotely from home, especially if you're in a shelter-at-home state or a work-from-home state currently where things have impacted. You also could use that information to identify pockets of the organization where you have critical staff that may be available later during the crisis. For example, you might have an orthopedic clinic or an orthopedic practice that has RNs available that could scrub in if you need them in actual operating room critical cases that come down the road. They might be situations where you can actually quickly train them to serve as a respiratory therapist if you are pushed to the limit. You could train them to go from a med-surg nurse to an ICU nurse. In these situations, licenses and some of the state licensures that have been in place are being forgiven, and hospitals are simply looking at their productivity reports to identify, number one, what resources do we have and where are they? Number two, how do we adjust our current staffing grids for where we are today, whether that's a reduced capacity or an increased capacity? And number three, how are we going to deploy our staff in the future if we need to? So another thing that I would bring to light that we are seeing is, typically hospitals have a lot of management positions, and those managers, more recently may have only been 10% actual bench, meaning that they're serving as a laboratory tech. or 10% of the time they're filling in as a radiology tech. We're seeing hospitals actually taking those managers and now stating, we need you to be 70% actually serving patients, or 80%, or forget the management component. Other than supervising and making sure you have your shifts properly staffed, we want you to help us treat patients. So we're seeing a lot of creative things, done around revisiting the staffing grids, working together across community lines, and even health systems that in the past haven't worked together within the same city are now coming together to pool resources.
Wow, that's kind of what I was thinking. That is very interesting. So you really have a shift, but it's not necessarily that you need to neglect kind of the metrics and the KPIs. You just kind of have to rethink how you use them then, right? It's just kind of that shift and try to adapt accordingly, but don't get away from things that matter, basically.
Absolutely. It is a shift in thinking of how you utilize the information, but this is not the time to abandon the tools that you've had in place to help you navigate. You still need to utilize that information to understand when you're going to need different levels of staffing, how many techs will you need, what nurses do you need, what support might you need in other areas such as radiology, laboratory, and use the tools to actually provide those projections so you can understand what the impact's going to be. One of the things a client is doing in a very hard-hit area is they've actually pulled resources into Team A, Team B, and Team C. And those teams include multidisciplinary teams that are actually rotating and coming in on rotations to treat the patients. So instead of having to worry about plugging individuals into particular pockets of a schedule, it's now a little bit simpler for them because it's Team A is on this shift, Team B is on this shift, Team C is on this shift. And it allows them to actually expedite and accelerate and spend more of their time on patient treatment.
Yeah, that is great. Very, very interesting. You gave some great examples. So just out of curiosity, so is the end, if you look at the high level metrics, is the end goal kind of to keep profitability, keep intact, and maybe avoid burnout and those? What are the very high level metrics I'm kind of curious about? I mean, it's really, if I was utilizing this service, which just sounds like it's so smart to do it, it would really be about trying to maintain my hospital and maintain my organization with some level of profitability and taking care of the employees as well. So, but go ahead.
Absolutely. In the short term, as we're working through the next 6 to 12 weeks of whatever this might be, I think the number one goal is to put your staff first. In a time of crisis, when we're dealing with the level of patient care that we're dealing with right now and the intensity of the care that is necessary to provide care for the patients that are going through COVID-19 or, and dealing with some comorbidities and situations that we haven't had to deal with as a society, the number one is to make sure that there are the proper resources for the actual staff. So right now, we need to place our staff first so that they can actually then take care of the patients. And what I mean by that is we need to put metrics in place and things in place to reduce the burnout wherever we can. We need to control the overtime and spread the overtime throughout the staff and balance that to the best of our ability so that we do not have individuals that are being leaned on more than others and are getting to the point that their overtime rates and they're working 24-hour shifts or 36-hour shifts. So we do need to take care of the staff. But the second piece there is the profitability component. Right now, in the short term, it's going to be very difficult for hospitals financially. And in order to actually manage what's occurring, you still need to keep your pulse on the financial perspective of things and understand how the day-to-day staffing decisions that you make regarding the COVID-19 crisis and regarding the staffing patterns is going to ultimately affect the bottom line of the organization. And what we know is it will deteriorate before it improves again. But what we're guiding our clients with is that if you have a plan in place and you continue to follow that plan, at the end of this, you can actually evolve and you can actually emerge from all this stronger than you've ever been. And that's really the key point, is to understand the staffing mix of your individual departments, understand your core staff, and what you need, and then ultimately how you can reposition things. We had one client that has done a lot of cross-training lately, and they haven't done the cross-training in areas that you typically experience. Typically you have registration clerks that they would register patients for only a small period of that time, and the rest of the time they might be sitting there waiting for the next patient to come in. Well, in this crisis, you need to really make sure that your staff is fully committed. So they're changing the actual triaging point, moving it outside of the emergency department so that they can actually identify which patients are being, possibly COVID-19 positive and which patients are not at an earlier point so that they're not infecting other individuals within the emergency department. We have also heard situations and stories where they've actually changed the patient through within the hospital so that there are particular elevators that are being dedicated to the actual patients COVID-19 or coronavirus positive, because the goal there is to make sure that different parts of your facility are being identified for different parts of the population. So they've changed the throughput and actually divided up the hospital into what you consider different elements. So if you have the patient population that is being treated for coronavirus, this is the area of our location that's providing that, and this is the other area that's not, so you have less contamination across those individuals, which impacts areas like your environmental services, housekeeping, and the amount of support that you need for nutritional services. Because if you're able to actually segment that, you're not going to have as many resources that need to deep clean rooms and disinfect rooms and sanitize rooms as often.
Yeah, such good points. Yeah, this is great. And yeah, I really love the idea that which is true, that they come out of this stronger than ever before. Sometimes it's these events, whether it's in business or personally, that kind of take their toll and they seem overwhelming, but in the end you kind of come out of it as, better than you ever were before. So I think that's a great way to maybe kind of end here. I look forward to having you on future podcasts, but it sounds like you guys are doing great work out there and really appreciate everything you're doing.
Thank you, Josh. I really appreciate you having me on the podcast. It's been great talking to your listeners. And, anyone that's looking for any examples, feel free to reach out.
Yeah, awesome. And yeah, everybody please tune into Stephanie's podcast, and she has some great roundtables and just a lot of great information. Check them out on LinkedIn or online. Thanks, Stephanie.
Thank you very much, Josh.